government is pushing ahead with its demand that dozens of dentists repay $20 million claimed under Medicare for treating people with chronic diseases. The government says some dentists rorted the system. Now, dentists say they simply fumbled the paperwork. It's one of the reasons the government wants to kill off the scheme, which was introduced by the Howard government. But despite questions over some dentists' work, both the Greens and Coalition say the scheme should be improved, not ditched. Mary Guerin reports.
We live in a country where if you can afford private dental services, you will have access to very good dental care. If you can't afford private dental services, and that's almost half of the population, you've got nothing. You've got a face full of pus.
Well, this is a poorly designed, poorly targeted scheme. You can be a millionaire and get dental work on this scheme, or you can be a kid with rotten teeth and not be eligible.
Dentistry has become a political football, centred on the chronic disease dental scheme, a scheme that's helped patients like Cora Connell.
All right, mate, here we go.
At 27, the mother of one has been struck down with an unknown condition that doctors believe might be similar to multiple sclerosis.
With her tremors and things, and it just affects the way that she's able to chew, to clean her teeth and do everything. So even just for her self-esteem, as well as the other complications that you get with gaps.
On a disability pension, Cora Connell couldn't afford the work needed and potentially faced months waiting in the public dental system. But the chronic disease dental scheme has allowed her and others with complex conditions to be treated by private dentists and bulk billed.
Our objective was to help the chronically ill. Financially, they couldn't afford the private sector, so it was great to be able to help them.
If it wasn't for Helen and these girls, I couldn't do any of it, really. I couldn't get a tooth ready for the headlock.
It was smiles all round for a while. So how did this all lead to a $700,000 bill for the owner of this Melbourne practice, Dr Helen Arabatsis?
We certainly cannot afford to repay that kind of money. Closure of my business will mean that a lot of people will be missing out on quality dental care and loss of about 28 jobs.
That tender there?
It all came down to the two things Dr Arabatsis and her 7 colleagues of the time failed to do, according to an audit by Medicare they voluntarily agreed to. First, they failed to send letters outlining the patient's treatment plan to their referring GPs before starting the work.
If there was any question about medications or medical history or protocol, you just pick up the phone and have a professional conversation. It does not normally happen by letter writing.
The dentists also failed to provide the patients with an itemised quote for the future work. Dr Arabatsis says that would have been irrelevant since her patients never paid a cent from their own pocket.
Medicare has never ever said that we billed incorrectly. We have always bulk billed, never asked for extra money from the patients, even though most of our treatments has financially exceeded what Medicare does pay us.
Once the audit was done, Dr Arabatsis says the dentists filled out the paperwork and did repay some money claimed in genuine error. But Medicare has demanded a total extraction of $713,000 for all the work delivered under the scheme because of the missing paperwork.
We had received no educational training from Medicare. It was a very new scheme.
The educative process that Medicare went through was scant, would be an appropriate way to describe it in the early days. It was certainly inconsistent, and you could describe it as being confusing.
Dentists have been told of these requirements on more than 10 occasions. They've been written to directly, firstly by Tony Abbott as Health Minister, and then a number of times by the government informing them of the requirements of the scheme.
Dr Arabatsis has been personally billed for the entire amount, even though it was incurred by 8 dentists over 2 years, and she says most has already gone in costs.
Audits are not the issue, it's the overzealousness and the significance of the severity of the penalty for this minor non-compliance.
There's only 2 ways that you can be audited. It's because a complaint's been made against you or that you stand out as a very high biller. I think if you're billing in the millions of dollars, you probably need to get your office systems right.
Dr Arabatsis says she's never been notified of a complaint and believes she'd only be seen as a high biller if all the work of all the dentists in her practice were attributed to her alone.
We are certainly not guilty of any rorting, and I have actually asked Medicare to come in and inspect my records.
They are then really, in truth, persecuting the dentists who have stuffed the paperwork, but nonetheless tried to do the right thing by the patients.
Associate Professor Hans Zollner is chairman of the Association for the Promotion of Oral Health. Although he's a passionate advocate of the chronic disease dental scheme, a report he's co-authored, soon to be released, analysing the scheme's first 2 years of operation nationwide, does raise questions about some work some dentists have performed.
What we're finding is that on average, every second patient is getting a crown. And that just seems to be a lot at first sight. So we can't be sure there really is over-servicing. That's an impression that we have. But it's also quite possible that every crown that's being placed is clinically justified.
Professor Zollner believes a pre-approval process for such procedures would clear up any doubt. And he's quick to point out he doesn't believe there's any statistical evidence of rorting.
If there was really widespread rorting, we would expect the expenditure on a per-patient basis to have always been at the maximum level, which in the first year of the scheme would have been a bit over $4,000 per patient. Well, it never reached anything like that sort of level. It was, at most, in fact, half of that.
The behaviour of the government is nothing short of disgraceful, and I'm really disappointed that they're sacrificing dentists because they don't like a scheme that was introduced by a previous government.
About 11,500 dental practitioners have made claims under the scheme, and as of October, 62 audits have been completed. Of those, 41 were found to have not complied with Medicare's requirements. To the government, the results represent an abuse of the system.
We've seen dentists who are charging the full $4,250 that's available per person under this scheme for one visit to the dentist. We've seen dentists that have provided dental prostheses that don't fit, dentures that don't fit.
The government is determined to end the scheme before revamping the public dental system.
We have already made 2 efforts to end this scheme, and whether we can end it after a third effort will depend a little bit on the opposition and the crossbenchers.
These are services that would never have been carried out had Tony Abbott not put in place this incredibly successful scheme, and I think that's why the government should stop their political game playing and build on the scheme to make it even more successful.
In any case, Dr Arabatsis is hoping her practice will be given a reprieve, whatever the fate of the scheme.
Mary Guerin with that report.